Might that be him over there?
I think the U.S. Public Health Services might be a military. Leaving nothing to be imagined. That's probably it. Dude, what a wild time we live in. Oh, I can take the tape back if you don't want to hold it.
I got it. It's in my pocket.
Awesome. Yes, Rear Admiral?
Oh, hi.
Hi. Yes, I am.
Dr. Wolf.
Wolf.
I'm Jane. Nice to meet you.
Thanks for coming.
Oh, hi. Great to meet you. Thanks for doing this. Thanks for doing this.
So you prefer to be introduced as Dr. Wolf?
Sure. Okay. This is my last day. I'm retiring on Sunday. So thank you for, this is my last, not the last thing I'm doing, but it's big public thing in uniform. So thanks. Yeah, Sunday.
So how are you usually working on that?
And I'm sorry.
Sure. So go ahead.
Oh, I grew up in North Carolina Valley. Great. Well, thank you. Thank you. That's where I'm deployed from. No.
Cool. So I just like
yeah, so
I'm Maddie.
oh yeah,
it turned out it was
not just
oh, that was my next question. What year was that? Yeah, so like right after.
我就知道我遇到你耶，
为什么？
直觉啊，觉得你会来这场。
大家都按了吗？
我已经按了。
啊，真的这么快？
看我在录到我刚跟你的对话了，妈的！
我想放着等一下，那我等一下再过来好了。
你怎么会来这场？
突然叫我来啊，没关系。That's great.
Great. So we want to. Yeah, I think that we've got our release coming out right now. So.
Oh yeah, there she is. Okay.
Do whatever's comfortable for you.
Morning, Commissioner.
Mark Sevilia with ADL.
Oh, thank you so much. I really appreciate it.
Thanks for having us. We appreciate it.
Yeah.
No, I totally get it too.
Great. Thank you so much.
Yeah, that we've been in so many events.
Yeah,
Ever
yeah.
since I was an intern, I think it's somewhat feel nice. It's been that many years.
Yeah. Okay. Oh.
Hi, Judy. Thank
Yeah.
you for doing this.
Oh, thank you. Golly.
Judy, I was like, I know this is not the biggest deal, but I was trying to ask at the briefing, like, the effectiveness of the masks. We have people freaking out.
Because they can't get one, but it's not effective, right?
Right, but in the meantime, I have local health and dental clinics that are telling me that they're going to shut down temporarily soon because they're running out of masks and just everyday supplies. So if people are buying masks and they're useless, can't we just tell them not to buy masks? Because the people who need it don't have it.
Hi, Mitch.
That is a good. Oh, so you went to the briefing then?
Really good.
Yeah. Well, how was it?
Well, Ash, you asked the question about if the drugs would be prescription or generic, and they said not generic, prescription. So that's a potential problem.
Sorry, may I introduce you? I'm Mitch Wolf with CDC. Nice to meet you. Sure. Over here.
How are you doing? Okay, and thank you for coming out on this cold morning. I know, California. It's 38 degrees.
I was like, it's such a nice day.
No, I said Grace probably said let's do it. I know. When I saw it trying to no. This is Grace's thing.
This is a test.
Lois is always like, I don't want to feel like people that have faces like this.
Oh my God.
Well, that's beautiful, babe.
Whoever said that.
I'm with you. I'm tropical.
I love this
Oh.
one.
The Admiral's here. That's awesome.
I wouldn't mind some more.
Oh.
I was doing it last night, which is really,
Yeah, then we can stay in.
okay, very good. Okay, we're going to start our press conference on the KPAC letter on the coronavirus myths. I want to thank you all for being here today for this incredibly important press conference and for helping us spread the word to our fellow members of Congress about the danger of misinformation around the coronavirus. Since the outbreak of the 2019 novel coronavirus, or COVID-19, rumors and conspiracy theories have spread faster than the disease itself. Like this fake letter which was sent out in Los Angeles, which actually has the logos of the World Health Organization, CDC, and LA County Public Health, and is a totally fake letter identifying 5 businesses that everybody should boycott because it has exposure to coronavirus. So these are very, very dangerous. And the thing too, of course, there was no outbreak at those particular stores. So this was an example of fake news meant to create fear. But even more dangerous are the rumors directly aimed at Chinese Americans. As a result, Asian Americans, even those who are not ethnically Chinese, have become targets of xenophobia and bigotry. For instance, a woman on a New York subway was physically attacked simply for wearing a face mask. A young high school boy in Los Angeles was attacked by bullies who claimed that he was having coronavirus. Another woman was accosted on an LA metro, subjected to a long rant about how dirty Chinese people are, even though she is of Thai descent. Other reports have come in from across the country of families being denied hotel rooms, customers refusing to be helped by an Asian cashier, and of children being bullied because of their ethnicity. And there has been an economic impact as well, as unfounded fears about catching COVID-19 have driven customers away from Asian-owned businesses. In my district, for example, restaurant owners have reported a 50% drop in business. The experience has been the same for Asian-owned businesses across the country, even though the CDC has repeatedly advised that the risk to the general public is low. The common thread in all of this xenophobia has been the steady flow of misinformation around COVID-19 and how it spreads. In each instance, attackers have acted on false rumors, like that just being Chinese makes one more likely to carry and spread COVID-19. Some rumors were even more dangerous, like the one saying that China created COVID-19 in a lab in Wuhan before unleashing it on the world. That rumor reinforces a narrative that China is an enemy, which puts Chinese Americans particularly at risk. And that's why I was so shocked to hear that particular rumor repeated by an elected official this month. As members of Congress, we have a particular responsibility during times of crisis to be reassuring and reliable sources of information, especially for our constituents. Sharing false rumors can put people at risk, and that is why we wrote this letter to every member of the House and Senate, reminding them of the dangers of spreading misinformation and helping us to be able to tell the truth. We want everyone to know that the risk of becoming infected with COVID-19 is not from ethnicity, it is from prolonged exposure to the virus. That means that you are safe going to an Asian-owned restaurant as you may be to any other restaurant. And it means you have nothing to fear from being with your Asian American friends and neighbors. But unfortunately, this false rumor is continuing to spread, which should be a call for each of us in Congress to react even more forcefully with accurate and reliable information. Our constituents are understandably worried about the spread of the disease and are looking to us for guidance and reassurance. Sharing inaccurate information is not only an abdication of that responsibility, it puts others in danger. Once again, the best way to stop the spread of COVID-19 is to practice good hygiene, such as washing your hands. Perpetuating racist stereotypes or inciting fear will not save lives. By working together, we can dispel false rumors built on fear, and we can address the public health crisis and also stop the disturbing racism targeting the Asian American community. And now we are very, very honored to have Dr. Mitch Wolf. He has been requested by many to come to press conferences and at seminars like this. but he came to ours. So I am very, very appreciative. He is a Rear Admiral in the U.S. Public Health Service, Chief Medical Officer for the Center for Disease Control. Dr. Wolf?
Thank you, Representative Chu, for the opportunity to highlight such an important issue. Stigma is the enemy of public health. It hurts everyone by creating fear or anger instead of focusing on the disease that is causing the problem. There are a lot of unknowns with coronavirus, and because of the disease is new, anxiety can be expected. It's critical that people do not let fear and panic guide their actions. Race and ethnicity is not a risk factor for coronavirus. For example, please don't assume that just because someone is of Asian descent that they have a new coronavirus. As an evidence-based, data-driven scientific agency, we urge people to learn the facts about coronavirus and the disease that the new coronavirus causes, COVID-19. CDC and other federal agencies, as well as local and state health officials, are resources for the American people, and we ask that people access and share the most reliable, up-to-date information. On our website, cdc.gov, we have extensive guidance for the public, for healthcare providers, for public health professionals, and for travelers, and importantly, for information for how all of us can combat stigma. Thank you.
Thank you so much, Dr. Wolf. And now we have the honor of having our CAPAC First Vice Chair, Congressmember Grace Meng of New York.
Good morning, everyone. I'm Congresswoman Grace Meng from Queens, New York, and I want to recognize and thank our CAPAC Chairwoman, Judy Chu, for her tremendous leadership on combating misinformation related to the coronavirus. As you all know, I represent one of the most diverse districts in the country, and over 40% of my district is home to Asian Pacific Americans. The novel coronavirus has raised many public health concerns, and it is imperative that public officials, including members of Congress, use their offices and visibility to confirm the facts and not to stoke people's unconfirmed fears. The coronavirus is a serious threat to public health, and we must have bold, effective leadership. But our efforts to contain this threat must not be paired with xenophobia, bigotry, or hatred targeted towards Asian Americans. Across the nation, there have been numerous instances of AAPIs discriminated against simply because of their ethnicity. As Chairwoman Chu mentioned, in New York City, my hometown, a man was assaulted and screamed an expletive at a woman who appeared AAPI because she simply wore a mask. This and other racist attacks are deeply disturbing, and we must redouble our efforts to ensure our fellow AAPIs are not unfairly targeted. And also in my district, there have been restaurants that have already been shut down because of poor business. Business has gone down also in my district, as Chairwoman Chu referenced for her home district. And we just got a text from local, just everyday persons about not visiting their local Korean supermarket or local restaurants for fear of expanding coronavirus. And unfortunately, for some public figures, including one of our colleagues, a member of Congress, they have trafficked in baseless rumors about the origins of the virus. Such harmful rhetoric is tragic. It harms innocent individuals, communities, and small businesses, and is counterproductive to ensuring that people know the facts. As elected representatives and leaders of different districts across the country that are home to AAPIs, we have a duty to call out misinformation, xenophobia, and speak truth to power. Thank you all for being here today.
And I might point out, even though the attendance at the New York restaurants have dropped, there hasn't been a single case of coronavirus in New York. Well, now it's my honor to introduce Congressmember Barbara Lee. She is co-chair of our CAPAC Health Task Force, and also has a huge Asian American population in her district of Oakland, California.
Thank you very much. And first, I want to thank you, Congresswoman Chu, for constantly staying vigilant, as we say, staying woke in my district, and bringing us together to really tell the truth and put the facts out. And I want to thank our public health officials and all of you here for being here with us today. Let me emphasize just what my colleagues have already said. First, it's appalling that people are using a public health crisis to justify and spread blatant xenophobia. Here in my hometown in Oakland, California, in Chinatown, this is very dangerous what is taking place, because in Chinatown it's been reported there's been a drop of about 50 to 75% in businesses. And that is such a severe economic impact in the 13th Congressional District. And so we've got to continue to educate the public that people of Asian descent are not more prone to carry coronavirus than any other racial demographic. I'm also concerned about our fellow members of Congress pushing unfounded and debunked conspiracy theories that do nothing but inflame tensions and put people at risk. As co-chair of the Health Task Force, as Congresswoman Chu mentioned for KPAC, I want to mention one thing, and that is that there are no indications, and this is another rumor that's been spread, there are no indications that coronavirus was created in a lab in China, and suggesting otherwise is deeply dangerous. Members of Congress have received numerous briefings on the spread of coronavirus. We know better than to push these alt-right talking points. Spreading these rumors under the guise of public safety isn't just dangerous, it's fundamentally wrong. No one community or ethnicity is more likely to carry coronavirus than any other. No one community or ethnicity is likely to infect someone with the virus than another. And the Asian-American community does not deserve to be targeted with these racist attacks. In closing, I just want to raise the Trump administration's completely inadequate, quite frankly, response to this public health crisis. As a member of the Appropriations Subcommittee, the Labor, Health, and Human Services Subcommittee, I can tell you that we will advance a well-thought-out, coordinated, fully funded whole-of-government funding package that rejects Trump's proposed budget cuts on the very programs that would help contain the spread of the virus. As CDC has advised us, as Congresswoman Chu said, the best way to stop coronavirus spread is to wash your hands, not spread racist stereotypes. Thank you again, and I want to thank you again, Congresswoman Chu, for sounding the alarm again on this issue. All the time we're under her leadership trying to get the truth out. So thank you again.
Thank you. And now we have the honor of having Rita Pin Ahrens, Executive Director of OCA, Asian Pacific American Advocates.
Good morning and thank you. I'm Rita Pin Ahrens, Executive Director of OCA, Asian Pacific American Advocates. OCA is a national membership-based civil rights organization that, with chapters all across the country, we engage with local communities and build power nationally to advocate for the social, economic, and political well-being of all Asian Americans and Pacific Islanders. Since the outbreak of coronavirus last December, OCA has been working hard to dispel misinformation concerning the virus and also to address the fear-driven xenophobic attacks against Asian Americans and Pacific Islanders, which has had really harmful effects on our communities in a profound way. In the months since the outbreak, Asian Americans and Pacific Islanders have been increasingly treated as threats to public health, even though the CDC considers there to be low immediate risk for all Americans. Rampant misinformation regarding the source of the virus and the misperception of higher infection rates amongst Chinese Americans and other Asian Americans has led to widespread discrimination, harassment, and violence. It is important to note that while coronavirus-driven xenophobia is primarily targeted at Chinese Americans, it has affected all Asian Americans. Across the country, our chapters are reporting diminished patronage of Asian American-owned businesses, from restaurants to grocery stores to nail salons and to other places, and forcing owners into financial crisis and sending workers home. In Houston, for example, our local chapter reports that Asian restaurants have suffered financial losses between 50 to 75%. Asian grocery stores have faced financial losses of up to 80%. And these are just reports coming in from one chapter. We've been hearing them across the country. We've also seen Asian Americans being avoided or harassed in public on the metro here in DC, being denied entry to public areas. We've also received reports of Asian American healthcare professionals being asked by patients when they are coming in sick to a clinic to be served by a different healthcare professional. And just a few weeks ago, an Asian American teenager in California was physically assaulted in school by his classmates, falsely accused of having coronavirus. The U.S. Department of Education reports that Asian American and Pacific Islander students already suffer from classroom bullying at the highest rates, higher than any other race and ethnicity. And we are already seeing an increase in anti-Asian bullying related to coronavirus in our schools. Therefore, we urge all school teachers and administrators and superintendents to address bullying and disease prevention in a non-discriminatory manner as required by Title VI of the 1964 Civil Rights Act. There's also guidance that can be followed following what the CDC issued for Ebola a number of years ago. OCA staff and chapters are working hard to proactively address coronavirus-related concerns in their respective communities, dispel information about the virus, and serve as a resource for harassment and discrimination against the Asian American and Pacific Islander community. Anyone who wants to report harassment, bullying, or discrimination that is related to coronavirus or other hate incidences can go to our website, AAPI-hatecrimes.org, and use our hate incident reporting tool. Ultimately, it is most important that we come together in these times of fear. I want to give special thanks to the Jewish Council for Public Affairs, which represents 75 national and local Jewish organizations around the country, for making a public pledge to help ensure that our AAPI community feels safe and supported, and to also combat xenophobic attacks and stereotyping of Asian Americans on social media. I urge other communities across the country to do the same, and I ask that all of our public officials be the examples for the rest of the country in standing up against corona-related xenophobia and attacks on the Asian American community. On behalf of OCA, I would like to express my heartfelt appreciation to the members of CAPAC for taking the initiative to address the ignorance and racist attacks on the Asian American and Pacific Islander community, fueled by misinformation and concerns about coronavirus. Thank you.
And our final speaker is Max Sevilla, Vice President of Government Relations, Advocacy and Community Engagement from the Anti-Defamation League.
Good morning, everyone. Thank you, Chairwoman, for your leadership on this important issue. ADL joins the distinguished members of Congress here and civil rights leaders to call on national influencers, members of the administration, and members of Congress to use their bully pulpit to correct misinformation and confront hate-mongering related to the coronavirus. Global anxiety about the outbreak of the virus has led to the spread of misinformation, scapegoating, and conspiracy theories. On notoriously extremist-friendly platforms online like Telegram, 4chan, and Gab, it's easy to find posts linking the coronavirus to racist and anti-Semitic slurs. For example, users across these channels regularly share racist messages or caricatures of Chinese people and those who are perceived as being Chinese, mocking their eating habits, accents, and hygiene, and linking these racist perceptions to the spread of the coronavirus. Others eagerly imagine the virus as a bioweapon. Extremists are also using the virus emergence to advance their anti-Semitic theories that Jews are responsible for creating it, are spreading it to increase their control over the world community, and they're profiting from it. These online racist messages are spreading not just in these fringe platforms, but also on mainstream social media, such as Reddit, Facebook, and Twitter. These online sentiments have also made their way into the physical world with the rise in racist anti-Asian incidents. Chinese people and those who are perceived to be as being Chinese, they're being harassed and their businesses avoided. To help ensure that Asian American Pacific Islanders feel safe and supported, and to combat attacks and stereotyping on social media, many of ADL's 25 regional offices are bringing together government leaders, law enforcement, and local organizations to pledge protection, support, and resources for individuals who are experiencing physical and verbal assaults. ADL has put together a new backgrounder on these extremist activities. And for students and families, we have created a coronavirus education guide to help ensure that discussions of health crisis don't resort to stereotypes and xenophobia in the classroom or anywhere else in our communities. These resources can be found on our website, adl.org, and are also being distributed through our networks. ADL stands in solidarity and support with all those affected by the virus and the communities confronting racism and xenophobia related to it. Thank you.
Well, thank you, and I thank ADL for being so proactive on this, and OCA as well for having the Hate Crimes Reporting Task Force, because we need people to report the things that are happening to them. So, are there any questions?
There were some complaints this morning related to the briefing from a few lawmakers saying that it started out a little bit, in their view, politically, rather than getting right to the science of it. I don't know if you all were a part of that, but if you'd like to just give us your view of what you think, how the briefings have gone, and whether you think they've been helpful.
I was there.
Yeah, Grace was there. I was not there.
I did go late, so I walked in as that presentation was being made. There were two members that shouted out that it was political, but you know, those I believe the chairwoman was stating facts, and so as negotiations are ongoing, it's important to keep in mind that investments have to be made before something like this occurs, and I think that's what she was implying.
Do you think the administration has done enough at this point?
The briefings have been helpful. Each briefing that I've gone to has been more and more well attended. Today's briefing was so well attended that we had to change locations because we couldn't fit all the members and the staff. They have been helpful, but there are still a lot of questions out there for members and constituents because inquiries and concerns are increasing as well.
What is your level of confidence that some type of funding level will be set within the next week or so, and that a package will come out and a vote will be taken perhaps in the next week or 2 weeks?
Well, I certainly think that the initial proposal of the Trump administration was severely underfunded. And this is a crisis that needs funding in all kinds of arenas. And so I know that our Democratic leaders have put forth higher levels of funding. And actually, the indication is that they are making progress on a better level of funding.
Do you have faith in Vice President Mike Pence's ability to lead the coronavirus task force?
I wish that there had been somebody who is from the scientific community, who has a background in this, who could have led us. Nonetheless, it is what it is. I mean, the most important thing is that we have proactive efforts on combating the coronavirus, and that all of us unite together in making sure that we do what we can, that we dispel the myths, and that we put out the truth in terms of how best we can combat it. Any other questions? If not, then thank you all very much.
Thank you.
Thank you.
Thanks,
Thank you
guys.
very
Great
much.
job.
Yeah, thank you. So you have the Because we were
Yes,
talking.
yeah, we were talking about it. So they have a mechanism already in place,
Right,
which we
and-
can direct people to.
And there is
Easy to remember.
yes, exactly, and there is a translation for in Chinese.
Oh, okay.
So I think we're going to work on getting additional translation.